Setting: hospital ward. Your patient is 20-year-old and is recovering following an appendectomy earlier today due to a ruptured appendix. He had a cannula inserted to administer antibiotics to treat an infection. The cannula has tissued, he is no longer working. So you see him to replace it and to do the clinical observation. Let's see the task now. First one says, explain reason for seeing the patient, replacing cannula due to tissuing. Then clinical observations. Second one says, find out how the patient is feeling, pain, fatigue, nausea. Third one says, reassure patient about pain, normal, temporary. Fourth one says, give information about pain relief such as already administered, time needed for full effects, offer to speak to the doctor about pain relief. Fifth one says, trust doctor to visit after the patient is settled in the ward. Clinical observation, give details of operation and recovery. Explain, need to replace cannula before doctor's visit. Current cannula not working, need to continue treatment of infection with antibiotics. Maintain hydration, etc. Sixth one says, give reason for tissuing of cannula, accumulation of fluids, patient moving around, vein, fragile, etc. Seventh one says, find out any other questions or concern. Eighth one says, emphasize the advantages of delivering antibiotics by cannula, direct to bloodstream, faster rupturing, more effective for infection. Ninth one says, explain when the patient is likely to change to oral medications in a few days. Last one says, establish patient's consent to replace cannula and to do clinical observation. Let's begin the role play now. Hi, good afternoon, Miss Sarah. I'm Roy, your attending nurse for today.
Good afternoon, Roy. I'm good.
Good to hear that, Miss Sarah. Today I'm here to replace your cannula as it is not working. Moreover, I need to do the clinical observations. By the way, may I know how are you feeling now?
I'm experiencing quite a bit of pain around the area where the dressing is applied.
I'm really sorry to hear that. You feel pain. Don't panic. It is quite common and it is due to tissuing. Other than that, are you experiencing any fatigue or nausea or anything else?
Nurse, I have tiredness, but not nauseous or anything else.
Okay, Ms. Sarah. Thank you for your information. First of all, I would like to inform you that the pain you are experiencing is quite normal, and I can assure you that it is temporary and it will not last for long. Moreover, I hope that the pain relief medications has already been administered for you, but it takes some time for the full effect. In case your pain persists for a long time, let me speak to the doctor for some additional pain relief medication. I hope you are okay with that.
Yes, nurse. I think I will probably need some additional pain relief, so please speak with the doctor.
Definitely, Miss Sarah. I'll speak to the doctor.
Well, nurse, I thought the doctor would have come here to see me already to tell me how the procedure went. However, I did not see him until now.
Yes, Miss Sarah, your concerns are sensible. The doctor usually visits patient after the clinical observation. I can assure you that the doctor will meet you shortly once you have been settled in the ward. During his visit, he will give more details of the operation and recovery. Okay, Miss Sarah, I hope you are following me.
Okay, nurse, I understand that.
Miss Sarah, as I mentioned to you already, the cannula needs to be replaced before the doctor's visit. Currently, your cannula is not working due to tissuing. In addition to that, it is very important to continue the antibiotics treatment in order to prevent the infection and also to maintain your hydration status. Do you have any more questions for me?
I really don't understand why did the cannula stop working?
Your question is really reasonable, Ms. Sarah. The cannula is not working because of tissuing of the cannula. For your better understanding, I'll explain to you in detail. Tissuing of cannula generally means leakage of intravenous fluids into the surrounding tissue. This is caused due to several reasons. One of the reasons can be the accumulation of fluid resulting in the spill of fluids. It can also happen when the patient moves around, causing a change in the position of the cannula. The next reason can be due to the veins' fragile nature. As a result of this issue, you are not receiving sufficient intravenous fluid. I think this is clear to you now. May I know if you have any more questions that need to be addressed?
Yes, nurse, it's very clear now, but I'm interested in knowing why can't I just get tablets rather than having another cannula inserted? Wouldn't that be more convenient?
Your thoughts are quite natural, Miss Sarah. The purpose of cannulation is to deliver fluids and antibiotics intravenously to improve your condition. Let me explain to you why the cannula is important in the situation, along with its advantages of delivering antibiotics via cannula. May I proceed?
Please, nurse.
The antibiotics and medications can be directly injected into the bloodstream, whereas an oral tablet needs several processes. Cannula is more effective than traditional oral supplementation. The nutrition is delivered faster and your body absorbs it more quickly. In addition, it is more effective to control infection. Is it clear to you now?
Yes, nurse, but I have one more question. Will the cannula be removed and replaced with oral medication soon?
I acknowledge your concern, Ms. Sarah. I can assure you that your intravenous antibiotics will be replaced with oral medications in a few days. I mean, once you have made the satisfactory improvement. Therefore, intravenous antibiotics are extremely important in this current situation to keep you safe and healthy. I hope you understand me.
Yes, nurse.
Finally, do you have any more questions or concerns for me?
No, nurse. Thank you very much for your support.
Good to know that, Ms. Sarah. Can I have your consent to replace the cannula and for the clinical observations?
You may please proceed, nurse.
Thank you, Ms. Sarah, for providing the consent. I'm going to replace your cannula now. In between, if you have any questions or concerns, you can ask me. I'll be happy to help you. Thank you, Ms. Sarah, for your kind cooperation and understanding. I wish you a faster recovery. Thank you, guys. Our role play ends here.